Common injuries of ankle and foot, lecture 5. Today we're gonna discuss about Bunions Deformity, Tarsal Tunnel Syndrome, Metatarsalgia and the Flatfeet. Let's start with the Bunions Deformity. The other name for this condition is hallux valgus. A bunion is a bony bump that develops on the inside of foot at the base of big toe. It is an important joint that helps distribute body weight across the foot when you are walking, running, or standing. Bunions form when bones at the front of your foot move out of place. This usually happens slowly, causing your big toe to move towards the smaller toes and forcing the joint at the base of the big toe to stick out. It can gradually worsen over time and may become painful. Surgery is the only way to get rid of bunions. Osteotomy is the surgical procedure performed to correct the bunion's deformity. Alternatives to surgery also include the use of orthotics, injections of cortisone, wearing shoes that accommodate bunion's deformity. Moving towards the tarsal tunnel syndrome. Tarsal tunnel syndrome is a condition caused by repeated pressure that results in damage on the posterior tibial nerve. Tibial nerve branches off of the sciatic nerve and is found near the ankle. The tibial nerve runs through the tarsal tunnel, which is a narrow passageway inside the ankle that is bound by bones and soft tissues. Damage of the tibial nerve typically occurs when the nerve is compressed as a result of consistent pressure. Symptoms: people with tarsal tunnel syndrome may experience pain, numbness, or tingling. This pain can be felt anywhere along the tibial nerve, but common in the sole of the foot or inside the ankle. This can feel like sharp shooting pains, pins and needles, and a burning sensation. Causes: several factors could lead to the tarsal tunnel syndrome, including flat feet, because flattened feet can stretch the tibial nerve, benign bony growths in tarsal tunnel, varicose veins, arthritis of the ankle joint, injuries or tumors like an ankle sprain or fracture, diabetes which makes the nerves more vulnerable to compression. Treatment: anti inflammatory medications to reduce inflammation, which may alleviate compression of nerves, steroid injections to reduce the swelling, braces and splints may be used to immobilize the foot and limit the movement that could compress the nerve. Surgery: the surgical option is the tarsal tunnel release. The next injury is metatarsalgia. Metatarsalgia is pain in the ball of the foot. It affects the metatarsals, which are the bones connecting the ankle bones to the toes. They are a common source of pain because they support your weight when you are standing, walking, and running. Management of metatarsalgia will involve rest, icing, use of metatarsal pads, considering arch supports, and wearing proper footwear. Next is the flat feet. The other name of this condition is pes planus. In flat foot, the arches on the inside of the feet flatten when pressure is put on them. A person with flat feet has no visible arch in the foot when they stand. Feet moves outward, that is the pronation, during weight bearing. Note: all babies have flat feet. Arches form during early childhood. If arches don't develop or they collapse later in life, it is called fallen arches. Types of flat feet. There are two kinds of flat feet. Number one, the flexible flat feet, and the two, rigid or true flat feet. Flexible flat feet. In flexible flat feet, arches flatten during weight bearing while stays normal during non weight bearing conditions. This is due to the weakness of the intrinsic muscle of the feet, rigid flat feet, or the true flat feet. In this condition, the arches remain flattened all the time, whether it is weight bearing position or a not weight bearing position. Now, there is factors. Factors that can increase the risk of flat feet include obesity, injury to the foot or ankle, rheumatoid arthritis, aging, and diabetes. Moving towards the management of flat feet. Orthotics and stretching exercises can help in flat feet. Arch support or insoles can be used. Loop band exercises can be performed. Gel ball exercises and towel exercises. In all these exercises, toe curls are performed which help in the arch's flexibility.